Hello, and welcome to Celiac.com news. Subscribe to our channel to get the latest celiac disease and gluten-free diet news. And if you have any questions, be sure to join the Celiac.com forum online at celiac.com. And now, let's move on to the latest Celiac.com news. Can you develop celiac disease later in life? Adult-onset symptoms. Many people think celiac disease starts in childhood and that being symptom-free into adulthood means you are safe. This is a misconception. Celiac disease can develop at any age, including your 30s, 40s, 50s, and later. For some, symptoms don't appear until decades after early life. Recognizing that adult-onset celiac is possible is important, as early detection can prevent years of discomfort, nutrient deficiencies, and complications. Celiac disease is an autoimmune disorder triggered by gluten, a protein in wheat, barley, and rye. In those affected, gluten prompts the immune system to attack the small intestine, damaging its lining and reducing nutrient absorption. While the disease is genetic, it doesn't affect everyone with the genes. Environmental factors, immune changes, and other triggers influence when it appears. Yes, adults can develop celiac disease even after years of eating gluten without issues. Some may have had mild, overlooked symptoms, while for others it appears suddenly after a trigger such as major illness, surgery, pregnancy, emotional stress, or gut microbiome changes from antibiotics or other medications. These can alter immune function, activating the disease in someone predisposed. Symptoms in adults vary and can be less obvious than in children. While some have digestive problems, others experience issues that seem unrelated to the gut. Common signs include diarrhea or constipation, bloating, abdominal pain, fatigue, iron deficiency anemia, weight loss, bone or joint pain, skin rashes, neurological problems, and mood changes. Because these mimic other conditions, many adults remain undiagnosed for years. If you suspect celiac disease, talk to a healthcare provider. Diagnosis typically involves blood tests for specific antibodies and an upper endoscopy with biopsies. You must continue eating gluten during testing. Removing it too soon can cause false negatives. Adults diagnosed later may also need bone density scans, as long-term malabsorption can weaken bones. Celiac disease in adults is often missed because symptoms are mistaken for IBS, food intolerances, or normal aging. Non-digestive symptoms may be treated without finding the cause, and if there's no family history, doctors may not suspect celiac. Gradual symptom development or years of adapting to discomfort can also delay diagnosis. The only treatment is a strict, lifelong gluten-free diet. For someone diagnosed later in life, the change can be difficult after decades of eating gluten. This means learning to read labels, avoiding cross-contamination, working with a dietitian, restoring nutrient levels, and having regular medical follow-ups. Many feel better within weeks or months, though gut healing may take longer. For those already living with celiac disease, knowing it can develop later helps support at-risk family members. If a relative develops unexplained symptoms, testing is worth considering. For those with gluten sensitivity, understanding late-onset celiac helps distinguish it from non-celiac gluten sensitivity and reinforces the importance of accurate diagnosis, since untreated celiac can lead to osteoporosis, infertility, and certain cancers. Celiac disease can appear at any stage of life, often after a trigger or gradual immune changes. Adults with unexplained digestive problems, fatigue, anemia, or related symptoms should discuss testing with their doctor. With proper diagnosis and a gluten-free diet, most see major improvements in health and quality of life. Awareness ensures no one is overlooked because of age. To get the latest celiac disease news and information, be sure to subscribe to Celiac.com news. Thank you for tuning in, and see you next time.